Hello, I'm Dr. Amy Schreibman. I'm a nurse practitioner and a doctor of nursing practice. Welcome to Medical Minutes. Today we're going to talk about exactly what heart failure is and what that means to you. Congestive heart failure, also known as CHF, is a chronic progressive condition that affects the pumping power of your heart muscle. While often referred to simply as heart failure, CHF specifically refers to the stage in which fluid builds up around the heart and causes it to pump inefficiently. Our hearts have 4 chambers. 2 on the top are called atria, and 2 on the bottom are called ventricles. The ventricle's job is to pump blood to your body's organs and tissues, and the atria receive blood from your body as it circulates back from the rest of your body. CHF develops when your ventricles can't pump blood sufficiently to the body, and therefore causes blood and other fluids to back up inside your lungs, your abdomen, your liver, and your lower body, like your feet and legs. CHF is not a diagnosis, but a symptom that occurs from one health condition that affects the cardiovascular system. Conditions like coronary artery disease, hypertension, heart valve disease, diabetes, thyroid disease, and obesity are all components that, if not well managed, can lead to CHF. Early symptoms of CHF can include fatigue, swelling in the ankles and/or feet, weight gain, and increased need to urinate, especially at night. Moderate CHF symptoms include irregular heart rate, cough from congested lungs, wheezing, and shortness of breath. The latest stages of CHF include chest pain that radiates to the upper body, rapid breathing, skin that appears with a bluish hue, and fainting. If experiencing later symptoms, you must call 911 and go to the nearest emergency room. The treatment of CHF depends on the stage of the root cause. Various types of heart medications are often prescribed to control heart rate and rhythm, along with diuretics or water pills, which eliminate the overload of fluid in the body, so the heart doesn't have to work as hard. In some cases, where there is valve disorders, surgery may be required to repair or replace the heart valve. It is equally important to stop smoking. Smoking damages your blood vessels, raises your blood pressure, reduces the amount of oxygen in your blood, and makes your heart beat faster. If you smoke, ask your healthcare provider to recommend a program to help you quit. Avoid secondhand smoke as well. Discuss weight monitoring with your doctor. Discuss with your healthcare provider how often you should weigh yourself, and ask your healthcare provider how much weight gain should you notify him or her about. Weight gain may mean that you're retaining fluids and need a change in your treatment plan. Check for any changes in your legs, your ankles, and your feet for swelling daily. Check with your healthcare provider if the swelling worsens. Eat a healthy diet. Aim to eat a diet that includes fruits, vegetables, whole grains, fat-free or low-fat dairy products, and lean proteins. Absolutely restrict your salt in your diet. Too much sodium contributes to water retention, which makes your heart work harder and causes shortness of breath, swollen legs, ankles, and feet. Maintain a healthy weight. Even losing a small amount of weight can help. You need to limit your fats and your cholesterol. In addition to avoiding high sodium foods, limit the amount of saturated fat, trans fat, and cholesterol in your diet. A diet that is high in fat and cholesterol is a risk factor for coronary artery disease, which often underlies and contributes to heart failure. Limit your alcohol and fluids. Drinking alcohol can interact with your medication, weaken your heart muscle, and increase your risk of abnormal heart rhythms. Be active. Moderate cardio activity helps the rest of your body to be healthy and conditioned, reducing the demands on your heart muscle. Before you start exercising, discuss with your healthcare provider about an exercise program that's right for you. Reduce your stress. When you're anxious or upset, your heart beats faster, you breathe more heavily, and your blood pressure often goes up. This can make heart failure worsen. So find ways to reduce your stress in life. Nap during the day, put your feet up when possible, and spend time that relaxes you and is enjoyable to keep your stress at bay. Sleep easy. If you're having shortness of breath, especially at night, sleep with your head propped up using a pillow or a wedge. If you snore or have had other sleep problems, make sure you get tested for sleep apnea. The earlier your condition is diagnosed and treated, the better your outlook will be. Your healthcare provider will determine the best treatment plan that's designed specifically for you. If you have any questions or you'd like to find out more information on what we discussed today, please feel free to leave them in the comments section below. I'm Dr. Amy Schreibman, and this is Medical Minutes. Please don't forget to follow us on Facebook and our website, The Boca Voice. I look forward to seeing you soon on the next Medical Minutes.